Yep. Let's grab now a cervical spine MRI. Clear that. Download. This is a 70 years old female patient. It says she has persistent neck pain. Of course, why not? Let's just grab a template, because since this patient has neck pain and is 70 years of age, I suppose she has major disease on her cervical spine, and the images are here. Let's just split the screen. No, this isn't much. I expected much more than this. This isn't that bad. There is a excuse me. There is a increased lordosis of the cervical spine right there. This could be just positional, because patient is clearly has a hyperextended neck. This is a malposition. This is to blame the technician. This is not a proper positioning of this patient, although it's all right. We can manage it. We have to report this anyway. There is a anterolisthesis, a slight dislocation of this vertebral body if compared to the next one. This is 2, this is 3, this is 4, and this is 5. So there is a spondylolisthesis or listhesis. There is a slight anterior dislocation of C5 over C6. This is degenerative, probably due to arthrosis of the facet joints right there, and it's major arthrosis, severe arthrosis, which makes sense. We also have arthrosis of the Atlanto-Axial joints, and of course the Occipital, Atlanto-Occipital joints right there. Also the uncovertebral joints right there, and right there, and there are also degenerated, bear signs of typical arthrosis. We have a dehydration, a chronic degenerative dehydration of the discs all over the place. This is quite common. She is 70 years of age, and I can see 2 tiny protruded discs in C3, C4, C5, just as expected. Nothing major on the vertebral canal. There is no there are no signs of stenosis, and I'm just going to roll the STIR, STIR, the fat saturated T2 weighted image, and there is a bunch of noise. This is quite common because this is a longer sequence, and clearly they can't program it right, so the programming is wrong. It gets too noisy, sometimes it gets too shaky, and we lose its point completely because we can't relate to this noise as disease. I'll go to the T1. T1 is here. It's also quite noisy. This is clearly a badly maintained scanner. It's a high field scanner for sure, but there is a huge lot of noise all over the field of view, which means this coil, this scanner, this gradient is all screwed over. This is in need of proper maintenance, and there is facet joint arthrosis. Let's look for neural foramina stenosis. No, nah, fine. And as you guys can see, it was oriented wrongly. The foramina are not properly imaged on this segment right there. It's crooked, it's wrong. but we can readily tell as much as possible that the foramina are fine. So we have spondylosis, tiny protruded discs, major arthrosis of the facet joints, and mild arthrosis of the other joints. No stenosis, no fractures, no tumors, nothing really of greater importance.